Hey guys, welcome back to my channel. This is Dr. Rajeshwar from yrpharmatube. In the previous video, we discussed benzodiazepines type of anticonvulsant agents. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of anticonvulsants and the other subjects of pharmaceutical sciences, click on the links given in the description box below this video. In this lesson, we shall learn about the miscellaneous anticonvulsants such as Primidone, Valproic acid, Gabapentin, and Felbamate. At the end of this video, you will be able to understand the miscellaneous anticonvulsants such as Primidone, Valproic acid, Gabapentin, and Felbamate. Primidone. Primidone was approved for medical use in the United States in 1964. It is a phenobarbital, that is a barbituric acid derivative where the carbonyl oxygen of the urea moiety is replaced by two hydrogen atoms. Its IUPAC name is 5-ethyl 5-phenyl 1,3-diazinane 4,6-dione or 5-ethyl 5-phenyl 4,6-pyrimidine-dione. Primidone is a pyrimidone, that is dihydropyrimidine 4H-dione substituted by an ethyl and a phenyl group at position 5. It has a role as an anticonvulsant, an environmental contaminant, and a xenobiotic. Primidone is synthesized by reacting or refluxing ethyl phenyl malonic acid diamide with formamide for 2 hours, during which the reactants undergo heterocyclization to the formation of primidone. The probable mechanism of this cyclization involved 3 stages, namely Cannizzaro type of disproportionation of formamide, deammoniation, and dehydration between ethyl phenyl malonamide and the resulting highly active methanolamine. Primidone is an odorless solid white crystalline powder. It is slightly bitter in taste and has melting point at 281.5 degrees centigrade. It is very slightly soluble in water, very slightly soluble in most organic solvents. When heated to decomposition, it emits toxic fumes of nitrogen oxides. The exact mechanism of primidone's anticonvulsant action is still unknown after over 50 years. It is believed to work via interactions with voltage-gated sodium channels that inhibit high-frequency repetitive firing of action potentials. Primidone and its metabolites phenobarbital and phenylethyl malonamide are active anticonvulsants. Primidone is sold under the brand name Mysolin. It is a medication used to treat partial and generalized seizures and essential tremors. It is used as an anticonvulsant for the treatment of various types of seizures. It is taken by mouth. The second drug of this class is valproic acid. The anti-seizure properties of valproic acid were discovered serendipitously when it was employed as a vehicle for other compounds that were being screened for anti-seizure activity. Valproic acid was originally synthesized in 1881 and came into medical use in 1962. It is a short branched chain saturated fatty acid or carboxylic acid that comprises of a propyl substituent on a pentanoic acid stem. Its IUPAC name is 2-propyl pentanoic acid or 2-propyl valeric acid or 2-dipropyl acetic acid. It is functionally related to a valeric acid and it is a conjugate acid of valproate. It has a role as an anticonvulsant, a GABA agent, a histamine inhibitor, a teratogenic agent, a psychotropic drug, a neuroprotective agent, and an antimaniac drug. Valproic acid is formulated as an oral syrup solution or in gelatin capsules. More commonly, the drug is used in a coordination complex referred to as divalproex sodium composed of equal parts of valproic acid and the salt sodium valproate. An extended release divalproex formulation in a hydrophilic polymer matrix allows once a day oral administration. Valproic acid has a pKa value of 4.56 and is therefore fully ionized at body pH. For that reason, the active form of the drug is the valproate ion regardless of whether valproic acid or the salt of the acid is administered. Valproic acid is one of the series of fatty carboxylic acids that have anti-seizure activity. This activity appears to be greatest for carbon chain lengths of 5 to 8 carbon atoms. The amides and esters of valproic acid are also active anti-seizure agents. Valproic acid was first synthesized in 1882 by Beverly S. Burton as an analog of valeric acid found naturally in valerian. Valproic acid synthesis begins with the reaction between 4-heptanol with hydrogen bromide forms 4-bromoheptane. This is then reacted with hydrogen cyanide, produces a cyanoderivative that is 4-cyanoheptane. On subsequent alkaline hydrolysis, the cyano group of 4-cyanoheptane converts into a carboxylic acid that is valproic acid. Valproic acid is a clear colorless liquid. It has a characteristic odor and has boiling point between 219 and 220 degrees centigrade. It is very soluble in organic solvents and freely soluble in 1-normal sodium hydroxide, methanol, alcohol, acetone, chloroform, benzene, ether, N-heptane, slightly soluble in 0.1 normal hydrochloric acid. When heated to decomposition, it emits acrid smoke and irritating fumes. Valproic acid is one of the few drugs that can be used in all types of epilepsy. Like carbamazepine and phenytoin, valproic acid decreases the influx of sodium ions and inhibits high-frequency firing of neurons. In addition, valproic acid blocks excitatory glutamate, that is NMDA receptors, and increases the inhibitor effects of GABA. These multiple actions are most likely the reason for its effectiveness in almost all types of epilepsy. Valproic acid administered alone produces very little sedation. Valproic acid and its derivatives are the medications primarily used to treat epilepsy and bipolar disorder and prevent migraine headaches. They are useful for the prevention of seizures in those with absence seizures, partial seizures, and generalized seizures. They can be given intravenously or by mouth, and the tablet form exists in both long and short-acting formulations. The next drug is gabapentin. Gabapentin was first approved for use in the United Kingdom in 1993. It is an anti-seizure drug, consists of a GABA molecule covalently bound to a lipophilic cyclohexane ring. After the formation of the ring, the amine and carboxylic acid groups are not in the same relative positions as they are in the GABA, more conformationally constrained. Gabapentin is a gamma amino acid that is cyclohexane substituted at position 1 by aminomethyl and carboxymethyl groups. It was designed to a centrally active GABA agonist with its high lipid solubility aimed at facilitating its transfer across the blood-brain barrier. Thus, it is a structural analog and a 3,3-disubstituted derivative of GABA. Therefore, it is a GABA analog as well as a gamma amino acid. It is similar to several other compounds that collectively are called gabapentinoids. Its IUPAC name is 2,1-aminomethyl cyclohexyl acetic acid or 1-aminomethyl cyclohexane acetic acid. Specifically, it is a derivative of GABA with a pentyl disubstitution at third position, hence the name gabapentin. It has a role as an anticonvulsant, a calcium channel blocker, an environmental contaminant, and a xenobiotic. A process for chemical synthesis and isolation of gabapentin with high yield and purity starts with the conversion of 1,1-cyclohexane diacetic anhydride to 1,1-cyclohexane diacetic acid monoamide. This is followed by a Hofmann rearrangement reaction in an aqueous solution of sodium hypobromite leads to the formation of gabapentin. Gabapentin is a white to off-white crystalline solid, crystals from ethanol or ether. It has a bitter taste and its melting point is between 165 and 167 degrees centigrade. It is freely soluble in water, alkaline and acidic solutions. Gabapentin is a GABA analog that appears to act by increasing the release of GABA from the central neurons. It has no direct effect on the GABA A receptor chloride ion channel itself. Gabapentin also inhibits the L-type calcium ion channels like pregabalin. Gabapentin is sold under the brand name Neurontin. It is an anticonvulsant medication primarily used to treat neuropathic pain caused by diabetic neuropathy, post-therapeutic neuralgia, and central pain. It is also used for partial seizures of epilepsy. And the last drug of this class is Felbamate. Felbamate was approved by the FDA for anti-seizure use in 1993. It was discovered by Frank Berger at Wallace Laboratories. It is the biscarbamate ester of 2-phenylpropane-1,3-diol. Its IUPAC name is 3-carbamoyl-oxy 2-phenylpropyl carbamate or 2-phenylpropane-1,3-diol dicarbamate or phenyl 1,3-propanediol dicarbamate. It is structurally related to the sedative hypnotic drug meprobamate. It has a role as an anticonvulsant and a neuroprotective agent. Felbamate is synthesized by reacting 2-phenyl-1,3-propanediol with ethyl carbamate. Felbamate is a solid white powder. It is odorless and has melting point at 151.5 degrees centigrade. It is slightly soluble in water, sparingly soluble in methanol, ethanol, acetone, and chloroform, freely soluble in dimethyl sulfoxide, 1-methyl-2-pyrrolidine, and dimethyl formamide. When heated to decomposition, it emits toxic vapors of nitrogen oxides. Felbamate has been proposed to have a unique dual mechanism of action as a positive modulator of GABA A receptors and as a blocker of NMDA receptors, particularly isoforms containing the NR2B subunit. Although it is clear that Felbamate does cause pharmacological inhibition of NMDA receptors, the relevance of NMDA receptors blockade as a strategy for the treatment of human epilepsy has been questioned. Therefore, the importance of the effects of Felbamate on NMDA receptors to its therapeutic action in epilepsy is uncertain. Felbamate is marketed under the brand name Felbatol. It is an anticonvulsant drug used in the treatment of epilepsy. It is used to treat partial seizures with and without generation in adults and partial and generalized seizures associated with Lennox-Gastaut syndrome in children. However, an increased risk of potentially fatal aplastic anemia and or liver failure limit the drug's usage to severe refractory epilepsy. This is the list of references followed for the lesson. That's all in this video. The miscellaneous anticonvulsants and individual drugs of the class Primidone, Valproic acid, Gabapentin and Felbamate. In the next lesson, we will discuss about the drugs acting on the autonomic nervous system. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.